Welcome back to CTV Morning Live. We're joined once again, Dr. Bernie Lalonde from the Chrysalis Rejuvenation Clinic. And I'm just hearing over the break, we've got lots of phone calls to get to. So we're going to start with Jim in Carlton Place. Good morning, Jim.
Yes, good morning. I was wondering if this is covered with the ODSP disability, and it was for bags under the eyes.
Sorry, can you just repeat that? It got a little bit loud here.
Yeah, it's for bags under the eyes. I'm 62 years old. My father had them. They've got continually worse, and I was wondering if it was covered with disability.
Highly unlikely. And these procedures, I think what you're referring to is something like a blepharoplasty, which is a surgical procedure to remove the bags underneath the eyes. Is that what you're referring to?
Yes, that's correct.
Yeah. No, that would not be covered by ODSP. It's not covered by any extended healthcare plans as well. You know, it's considered a cosmetic procedure. Sometimes the bags above the eyes, if there's a critical level, if they start covering the vision, that is covered by OHIP. But the ones below the eyes, as far as I'm aware, it is not covered by OHIP or ODSP.
And speaking of the bags that you were talking about, the droopiness, that is something that you were saying could be lifted by one of the procedures?
Well, it depends on the extent. I mean, at one point you've got to be realistic. If they come in and it's so far gone, I mean, there's no sense in spending any money when it's only going to be a very small improvement. And so those people I would send off to see a surgeon. But if it's only a partial droopiness, I think there's a variety of things, including Botox, including thermage, including some of the fractionated therapies that we talked about earlier in the show as well, can all help lift that area.
Okay, interesting information. We're going to get to Carly now, who's also on the phone. Good morning, Carly.
Oh, good morning. I had a dermabrasion done for, I had a bunch of little cysts all over my face about maybe 15, 18 years ago. And it was great for a while, but now I'm starting to notice like the little wrinkles and that coming in. Having had such an extreme procedure before, would I be a candidate to get at the new wrinkles, let's call them now, or would it be?
No, I think there's no problem at this stage of the game to consider something like the Fraxel treatment or the SmartXide CO2, those resurfacing lasers. I think you could very well easily be a good candidate for those procedures.
Okay, so it wouldn't be too much.
That's right, and you probably had the dermabrasion that was done under anesthetic.
Exactly,
yeah.
And I was like 6 weeks off work.
No, these new modern procedures, you're going to be with the Fraxel off work for maybe 2 days, a weekend, and the CO2 maybe a week.
Oh, excellent.
Yeah.
Thank you
very much.
Okay, you're welcome.
You know, looking at that time frame, that's a long time, 15 to years between treatments. So that was a success, in terms of seeing it last that long. But it's okay after a certain amount of time to get back.
But you can see how we've evolved, because I mean, what she said 15 years ago, she was off work for 6 weeks. And the original CO2 lasers were like that too. People were off work for 4 to 6 weeks, and now the new fractionated technology, which means that the whole surface isn't affected the same way, and the skin rejuvenates very, very quickly, and that's why the people can get back to work within a week.
Carly, good luck with that. And I believe, is it Marlene? Marlene's on the phone as well. Good morning, Marlene.
Hello, how are you?
We're great. What's your question for Dr. Lalonde?
He had said that crow's feet, it only lasts 4 weeks or 4 months with the Botox.
Yes.
I was just wondering what happens if you do. You said the laser was overkill, but how long does that last, and how long does it how much does it cost if you had the laser instead?
Well, the problem with doing a laser resurfacing in a spot area around the face is that it can depigment the skin somewhat. So all of a sudden, if you had just the crow's feet done with the laser, that area may be slightly paler than the other area. And I don't think you'd like that, because then you'd have to cover that with makeup all the time. So generally speaking, when we do a laser resurfacing, it's the entire face, so that you don't have any pigment issues. Some people, for instance, have had it done in the past just around the mouth, and all of a sudden they've got this white ring around the mouth that makes them look a bit like Homer Simpson or something. So that's not terribly attractive. So that's the downside of treating crow's feet with lasers, is that you really have to do the entire face. Whereas Botox, relatively inexpensive. I think for $100 to $150, you get 4 months out of it. Well, you know, it's like having your hair done, I suppose, every 4 months or something like that.
Well, yeah, it's a different way of looking at it when you're looking at that type of investment.
That's right, you know. So those are the options. I mean, you can come in and we can discuss it. There are a few other options that we can do as well. Of course, the cost difference is significant. With the laser resurfacing, you're looking something in the $1,000 to $2,000 range, okay? Whereas with Botox, as we just discussed, it's only about $150 for the crow's feet.
Oh, Marlene, hopefully we answered your question there. And we have, I think, Monique now who's on the phone. We'll take her call. Monique?
Yes, hi.
Hi, good morning.
Good morning. Happy New Year.
Happy New Year to you.
I have a question for Dr. Lalonde regarding excessive sweating at the back, at the waist. I started this many years ago. I don't perspire so much under the arms. It's basically in my back area, right at the waist and going down. So in the summertime, I'm soaking wet before I even have a chance to, you know, do anything. When I exercise, it's unbelievable. So I was wondering if I did call the center and was told sort of an amount for the Botox. She quoted me around $800 for underarms. I was wondering if you could tell me what it would cost me for the back.
I'll be perfectly honest, I've never done sweating in the lower back area, nor have I read about it or heard about it.
It's all right,
but and I go to a lot of meetings related to these procedures.
Yeah.
But I certainly have done it a lot in the arms, in the hands, in the forehead for excess sweating. So there's probably not too much reason why you cannot do it on the back, but I'd have to research it a bit.
Exactly.
A lot, of course, depends on the area involved. I mean, Botox, it depends on how many units you use. In the arms, we tend to use about 50 units per armpit. So it generally comes out into the $700 or $800 price range, okay? But if you... when I get back to the office today, I'm going to research that and find out if anybody else has done it in the lower back area. Of course, we'd have to sort of map it out. You know, there's what we call a starch dye test where we can find out the area, how big that area is where you're sweating, and then we can come up with a price of how many units we have to use.
And that's the beauty there. You can check out more information. You can give the center a call, give the clinic a call, check things out on the website. Always a pleasure to see you here. You have your questions. The information will be listed on your screen as to how you can get a hold of the Chrysalis Rejuvenation Clinic and maybe get in and ask your questions, and they can look at it, you know, exactly for you to see exactly what it is that you're dealing with. We are going to take a short commercial break. We're going to be joining in with the boys. They're in the kitchen coming up after this with Grill 41. We're back after this.